Welcome to the deep dive. This is where we take sources you send us, interesting topics, and really try to pull out the key insights.
Yep.
Today, we're diving into something, well, a bit unexpected, perhaps. Ketamine.
Right.
And its potential role, believe it or not, in cancer treatment.
Specifically, non-small cell lung cancer.
Mhm.
A listener flagged a really fascinating abstract. It's from the AACR meeting 2025.
ACR, okay.
Yeah.
And the title gives it away a bit. Circulating Rare Events as a Biomarker of Anti-Tumoral Effect of Ketamine Therapy.
Exactly. And what really caught our eye, and probably yours too, is this finding that just seems, well, it seems backwards.
Totally backwards. It suggests using ketamine, the anesthetic, during lung tumor removal surgery is actually linked to a lower chance of the cancer coming back.
Which sounds great.
It does. But then, here's the kicker. It also seems to cause this temporary increase in something called circulating rare events in the blood.
Right. Which you normally think, oh, that sounds bad, more stuff circulating.
Exactly. So, more circulating things, but better outcomes. Makes you pause.
It really does. So to understand these circulating rare events, or CREs, we did look briefly at another paper, Longitudinal Tracking of Circulating Rare Events, just for background.
Right, just to get a handle on what CREs are. But we'll keep it simple, promise.
Yeah, no getting lost in the weeds.
Our goal here is just to understand what this research might mean. And we've got our expert here to help us unpack it all.
Yeah.
So you saw this abstract and just thought, ketamine, cancer. Need to look at this.
Definitely. Okay, so first things first, maybe just a quick word on non-small cell lung cancer, NSCLC.
Good idea.
It's very common. And the tough part is, even when surgery seems successful, when they get the tumor out,
Yeah.
a lot of patients unfortunately see the cancer come back. Recurrence is a huge challenge.
How many? Like, what sort of numbers are we talking?
It's significant. Estimates vary, but maybe somewhere between 30%, even up to 55% of patients.
Wow. So over half in some cases, even after surgery.
Exactly. It's a major hurdle.
Okay, so that sets the stage. And these circulating rare events, the CREs, they fit in here somehow.
They do. Think of CREs as, well, cells, or maybe just fragments of cells that you don't typically find floating around in large numbers in the bloodstream of healthy people.
Unusual signals, basically.
Kind of like that, yeah. Signals that might tell us something's going on.
And that other paper, the longitudinal tracking one, helped clarify what these might be.
It did. It helps explain that CREs can include things like circulating tumor cells, CTCs.
Cancer cells that have broken off.
Right. Broken off the main tumor, traveling in the blood. But CREs can also be other things, like oncosomes.
Oncosomes.
Yeah, they're like larger packages, vesicles that cancer cells release. The point is, these CREs, whatever they are specifically, might play a role in cancer spread, or at least give us clues about the tumor.
Okay, got it. So potentially dodgy things floating in the blood. Now connect that back to the ketamine.
Right, so the abstract we're focused on points to this observation.
Yeah.
Using ketamine during the NSCLC surgery seemed linked to a lower chance of recurrence later on.
Which is the weird part for an anesthetic. You wouldn't expect it to affect cancer long term.
Exactly. It's really surprising. Now, this was initially a retrospective finding. They looked back at patient data.
Ah, so they noticed a pattern in patients who'd already had surgery with either ketamine or another drug.
Correct. The comparison was with dexmedetomidine, or DEX. They saw this link between the anesthetic used and recurrence rates. It wasn't the original goal, but the pattern was there.
Okay. And that led to the study in the abstract we have.
Yes. That earlier observation prompted this more focused study. They took 22 patients, early stage NSCLC, all having surgery.
And they took blood samples.
Yep. Before the surgery, then immediately after, and then again, 3 weeks later.
3 weeks. Why that specific timing? Why not, say, 1 week or 1 day?
Good question. That 3-week point is pretty crucial, actually. The sample right after surgery shows the immediate impact. But waiting 3 weeks lets you see if there are more dilemma effects, how things settle down or change over a bit more time.
Okay. And what did they find at 3 weeks?
This is where it gets really interesting, as you said. Right after surgery, not much difference in CRE levels between the ketamine group and the DEX group.
Okay, so initially, no big signal.
But then, at that 3-week mark, the ketamine group actually had a higher incidence of these CREs. Higher. And specifically, an increase in cells that looked like endothelial cells.
Endothelial cells. Those are the ones lining blood vessels, right?
Exactly. Which is interesting because tumors need blood vessels, angiogenesis, to grow and spread. So affecting those cells could be important.
Okay, hold on. Let me get this straight. The earlier data hinted ketamine led to less cancer coming back.
Correct.
But this study shows that 3 weeks after surgery, the ketamine group has more of these potentially dodgy CREs, including blood vessel-related cells circulating.
That's the paradox.
That just doesn't compute immediately. More circulating stuff, but better long-term results. Okay, let's unpack this.
Right. It feels completely counterintuitive.
Right.
But the researchers, they have a hypothesis.
Okay, let's hear it.
They suggest that maybe this temporary increase in CREs, especially those endothelial-like cells, maybe it means the ketamine is disrupting the tumor's environment somehow.
Disrupting how?
Perhaps making the tumor, or bits related to it, shed more easily into the bloodstream around the time of surgery.
Okay. But wouldn't more shedding be bad, like seeding new tumors?
That's the logical first thought, absolutely.
Yeah.
And it highlights how complex this is. But the idea, the hypothesis, is that maybe this increased shedding right around the surgery isn't necessarily bad in the long run.
How so?
Well, perhaps. And this is speculative. Perhaps having more of these cells or fragments circulating at that specific time makes them more visible or vulnerable to the body's own immune system.
Ah, like flushing them out into the open where the immune system can see them better.
Something like that. Or maybe it makes them more susceptible to any follow-up treatments the patient might get. It's like a temporary surge that ultimately leads to better clearance.
So the really mind-bending idea here, what we might think is a danger sign, more CREs, could actually be a sign that the ketamine is doing something beneficial long-term.
That's the core hypothesis, yes.
Mm-hmm.
It challenges the simple idea that more circulating tumor material always equals worse outcomes. Context matters. Timing matters.
Wow. Okay. That really flips the script on how we might interpret these biomarkers.
It does, but, and this is really important, it is still a hypothesis based on early findings with a small group.
Right. Needs much more research. Absolutely.
Definitely. Needs validation, needs digging into the exact mechanisms.
It's mentioned the lead author, Anya Shah. She's a cancer survivor herself.
Yes, that's noted. She works at the USC Convergent Science Institute in cancer.
That personal connection, it adds weight, doesn't it? A drive to find new angles.
It certainly suggests a deep motivation behind the work. And the work itself points towards ketamine potentially acting almost like a modulator of the tumor environment during that critical surgical window.
The perioperative period, they call it.
Exactly. Not just knocking the patient out, but maybe actively influencing the cancer biology.
So the big takeaway isn't just ketamine might help. It's that the way it helps could be really complex, involving this weird spike in CREs that might actually be good news.
In a roundabout way, potentially yes. The increase might be a sign of the drug interacting with the tumor beneficially, ultimately reducing recurrence risk. It's a fascinating possibility.
Okay, so what does this all mean for you listening? It means a familiar drug, ketamine, might have this completely unexpected role in fighting lung cancer.
And it really highlights how intricate cancer biology is and how much we're still learning about drug interactions and the body's response.
It makes you wonder, doesn't it?
It does. Could other common drugs have hidden benefits like this? Unforeseen effects on tumors that we just haven't spotted yet?
That is a seriously thought-provoking question to end on.
It reminds us, that sometimes breakthroughs come from looking at old things in a totally new light. Even established drugs might surprise us.
Well, thanks for walking us through that. It's complex, but really intriguing stuff.
My pleasure. It's definitely early days for this specific idea, but it's a great example of the kind of unexpected connections research can uncover.
Yeah, it hammers home that point about biomarkers more isn't always worse. It depends on the context.
Precisely.
So a final thought to leave you with. If a common anesthetic might affect cancer outcomes in this paradoxical way, what other everyday medications could be quietly influencing our body's fight against disease and ones we don't understand yet? What other counterintuitive findings are out there waiting? Something to chew on. Let us know your thoughts.